తలనొప్పి, నరాల బలహీనత, మూర్ఛ వ్యాధి, పక్ష.
Dr. Rao's hospital offers the best brain tumor treatment in Andhra Pradesh. When you choose Dr. Rao's hospital for brain tumor treatment, you get access to experts who focus on brain tumors in a minimally invasive way. Our medical head, Dr. Mohana Rao Padabandla, is an expert brain tumor doctor in Andhra Pradesh. Since brain tumors account for only 1% to 2% of all cancer, most oncologists have limited experience treating and managing their symptoms. What is a brain tumor? The abnormal growth of cells in the brain forms a mass or lump termed a brain tumor. The growth rate and location of your brain tumor determine how it will affect your nervous system's function. What are the types of brain tumors? Primary brain tumors. The primary tumors develop when normal cells acquire errors, mutations, in their DNA. The mutations allow cells to grow and divide at increased rates and continue living when healthy cells die. It results in the growth of a mass of abnormal cells, which forms a tumor. The primary tumors originate in the brain or the surrounding tissues, including the brain-covering membrane, meninges, cranial nerves, pituitary gland, or pineal gland. Primary tumors are rare as compared to other cancers of the body. However, it constitutes about 1% to 2% of the total cancers. But it is responsible for around 20% of deaths due to cancer-related causes. The incidence is about 2/10,000 people in India. Primary tumors are both benign and malignant. About 33% of primary brain tumors are malignant. No age group is saved from brain tumors. It affects all from pediatric age groups to elderly patients. There are various types of primary brain tumors. Examples include gliomas, meningiomas, acoustic neuromas, pituitary adenoma, medulloblastomas, germ cell tumors, craniopharyngiomas. Secondary brain tumors. Secondary tumors are metastatic from malignancies of other body parts. These tumors emerge from cancer that originates elsewhere in the body and then spreads to your brain. These tumors most often develop in people with a history of cancer. But in rare conditions, a metastatic brain tumor may be the initial sign of cancer that originated elsewhere in your body. The common types of cancer that can spread to the brain include breast cancer, colon cancer, kidney cancer, lung cancer, melanoma. Symptoms of brain tumor: change in headache patterns, frequent and severe headaches, unexplained nausea and vomiting, vision problems, a gradual loss of sensation, arm mobility in arm or leg, difficulty in balance or speech, confusion in everyday matters, personality or behavior changes, seizures, hearing problems, etc. When to consult a doctor? Contact your doctor if you have persistent signs and symptoms that concern you. Book an appointment at Dr. Rao's hospital. Diagnosis of brain tumor. Your doctor may recommend the below tests and procedures to diagnose a brain tumor. Neurological exam. A neurological exam may include testing your vision, hearing, strength, balance, coordination, and reflexes. Problems in one or more areas may give signs about the part of your brain that may have a tumor. Imaging tests. Magnetic resonance imaging, MRI. Computerized tomography, CT. PET. Biopsy. A biopsy can be implemented as part of surgery to remove the brain tumor. Your surgeon may perform a stereotactic needle biopsy for brain tumors in hard-to-reach areas or susceptible areas within your brain that a more extensive surgery might damage. The biopsy sample is then observed under a microscope to find if it is cancerous or benign. Brain tumor treatment in Andhra Pradesh. The treatment depends on the kind of brain tumor you have and its size and location. Surgery. Surgery aims to remove the mass effect, obtain tissue for histopathological examination and excision of mass to cure the condition. The surgery focuses on total or gross total excision. But in the case of inoperable tumors, near total excision or simple decompression is also done. Surgery causes immediate relief in mass effect. The surgery usually cures benign tumors. But malignant tumors also require chemotherapy or radiotherapy as an adjuvant. Recurrence is the rule in the case of malignant brain tumors. But recurrence-free survival depends on the kind and grade of the brain tumor. Moreover, even after recurrence, surgery is the first line of management. Neurophysiological monitoring. It is an advanced approach to neurological procedures. Many tumors are present in areas where any attempt to remove them may cause permanent neurodeficits. Intraoperative neurophysiological monitoring is the real-time recording of various brain activities during surgery. Even touching vital structures can directly reflect changes in NP monitoring. NP can save those structures and avoid deficits. It helps in the safe excision of tumors. Microscopy. The use of a high-resolution microscope with some additional features dramatically facilitates mass identification and safe excision. Stereotactic radiosurgery. It is a new concept that uses a stereotactic frame to approach the lesion without craniotomy and damage the vital structures. The tumors which are not attainable or at eloquent areas can be approached through stereotactic surgery. It also helps obtain tissue for histopathological diagnosis. So, we can initiate other therapies. Thus, brain tumors that were considered untreatable are now treatable. Gamma knife. Gamma knife is a type of focused radiotherapy. It helps deliver computer software-based, multiple sources a high dose of radiation to the brain's small diseased area without affecting surrounding brain tissue, thus avoiding the side effects of whole brain radiation. A gamma knife can treat tumors that are inoperable or inaccessible. Chemotherapy. It has a limited role in brain tumors due to the presence of the blood-brain barrier. Few chemotherapeutic agents like carmustine, CCNU, temozolomide, cytarabine, procarbazine, vinblastine, etc., are effective against brain tumors. Chemotherapy is often done as an adjuvant to surgery. Radiotherapy. It is also adjuvant to surgery. As alone, it has a limited role but potential side effects in the form of radiation necrosis. 8. Immunotherapy. It is in the developing phase. Few molecules are developed to target the molecular pathology of the brain tumor. Causes of brain tumor. Multiple mutations, deletions, aberrations, and several genetic gateways are identified, and their role in the pathogenesis of brain tumors is also confirmed. Infections such as EBV are also accountable for tumors like lymphomas. Some tumors like Rathke's cleft cyst, craniopharyngiomas, epidermoid, dermoid, etc., are considered to be due to abnormal development. Risk factors for brain tumors. The below factors may increase the risk of developing a brain tumor. Radiation exposure. People exposed to a type of radiation called ionizing radiation have an increased risk of brain tumors. Some examples of ionizing radiation are radiation therapy used to treat cancer and radiation exposure caused by atomic bombs. Family history of brain tumors. Brain tumors may occur in people with a family history of brain tumors or genetic syndromes that increase brain tumors risk. Thanks for watching.